Good evening, ladies and gentlemen. Health begins before you wake up. Yes, this is a sleep lecture. And judging by the patients that we treat in the office and our YouTube followers, I know that we have a lot of insomniacs out there. So I dedicate this lecture to you guys. Here's my contact information. Addressing mental illness will be my next lecture. And boy, is this a time to really have a lecture like this put out. Unfortunately, right now, I do not know the date and time of this lecture. I normally would do something like this at the end of September, but given that busier at the office and being more tied up on the weekends with my kids, it may be pushed back a little bit. So I'll keep you guys posted on that. Any shooting at any school is a tragedy, period. But is guns the real problem or mental health the real issue? I think we all know the answer to that. Dr. Gill's next lecture will be at the end of August, what has happened to us. I asked him today about what this was going to be exactly. He's just got a bunch of general information he's going to kind of put out there for this lecture. Dr. Tent's next one, December, it's written all over your face. It's always a surprise with what he's going to talk about. If you want help with your health and are interested in having a virtual appointment with us, we would love to help. We are all over every social media platform, and whatever gets taken down, we post it elsewhere. So we will continue to post and put all that information out there for you guys. I personally like the Instagram stuff. I post a lot on that. On the Tuesdays, I do a lot of the Q&As. Thursdays, I will go live 5 to 10 minutes at a time. The attention span of people absolutely sucks. It's getting worse and worse and worse. If I could just do little tidbits of information, put it out there, it seems to get through better to people because it's just getting worse and worse. If you've had a good experience with us and you want to be recorded on our Instagram stuff and tell it to everyone, stop next time you're in the office, let us know. We work hard for you guys. We really do, and we got a lot of cool stuff that's coming down the line. We're working with Quest and actually going to be doing blood draws within the office. We're doing these heart scans with patients. I had a patient that this probably saved her life. She had a 90% blockage on her left carotid with the heart scan that we do at the office. And not only did it save her, but also it saves us at the same time. Doing neck manipulations and having a 90% blockage is a risk to us in our type of practice. And we were able to find that through the heart scan and all that. So we'll be posting more on that on the newsletter, on the Instagram stuff, so you guys know a little bit more about exactly what that entails. But with the Quest stuff, we're able to use and utilize insurance and bill your insurance for lab work going forward. And we're going to have a phlebotomist within our office here. So we're really excited to help save you guys money, given that the gas prices and food prices seem to continue to go up. If you've had a good experience with us and you want to write us a review, we'd love to hear it. Biotics Research had their second functional medicine conference. This one was not in Texas, but in North Carolina. Me, Dr. Gill, and Dr. Tent all went down there. We all had a good time, learned a lot of great information to bring back to the office. Snapped a cool picture in the downtown area with Childlike Faith. I crack its spine to find a world of wisdom. My big head's covering up the sea there. But yeah, we had a great time down there. And as soon as we dove into some afternoon session on female hormones, Dr. Tent kind of just dozed off on the female hormone section there. But you know, if that tells you how much he likes to deal with female hormones, Dr. Gill and I would be glad to help you guys out with your hormones. As you know, Dr. Tent's not a huge fan of it. You know, they brought up some awesome stuff at the seminar, something that we've been seeing at the office a lot as well, that with COVID, long COVID, that it's driving up a lot of autoimmune markers on individuals. This viral load has pushed some people over the edge into having autoimmune conditions. Do you think if having COVID or a strong viral load in general, if it could push autoimmune markers in people, can it push cancer markers in cancer in people? Absolutely yes. And I think that's something you may hear about going forward down the road as well too. Possibly from the jab, who knows? Long COVID is a great topic. This are some of the top symptoms that people have been dealing with post-COVID as far as long COVID goes. Top thing, obviously, fatigue, post-exertional fatigue, brain fog, sensory issues, headaches, memory issues. You see insomnia on there and other sleep issues at the bottom, given that this is a sleep lecture. And some of these issues, the high stress and the cortisol issue is probably a big reasoning to having some of this insomnia and sleep issue that's correlated with the long COVID. Early in February, developmental milestones have changed per CDC. Crawling is no longer a milestone. Walking changed from 12 months to 18 months. Talking changed from 12 months to 15 months. They keep normalizing sick kids to you, and that this is the new normal. It's not. 5 and 7 now, healthy kids doing simple stuff. You follow my Instagram stuff, you follow my lectures, I'm giving you a ton of my protocols and things that we do with the kids at the office. You guys need a functional shake that's going to do something for you. I like the collagen, I like the mitochondria. I talked about this in the last few lectures. Check it out if you haven't done a few rounds of this. You want some boost of energy and glutathione support, check out that type of shake. Collagen is rich in an amino acid called glycine. Glycine has hypothermic effects and helps with sleeping. The details of the mechanism remains poorly understood, but glycine helps people sleep. I found this intriguing because if you've been a long-term patient in our office, we used to use a product at our office called AminoSculpt, and we used to use it for more weight loss purposes. But when people were taking this AminoSculpt and a few tablespoons at night, they were reporting to me that they were sleeping great and their hair and nails was growing great. So I know that glycine component has helped these individuals sleep. So if you're doing that shake and incorporating that collagen, you want to try moving that around to the evening. You could play around with that and see how that helps with the sleep. Diving into this, I had to relearn how to sleep after 3-4 years. My kids are 5 and 7. Both my boys never slept good. It has been musical bedrooms, wake up, interrupted sleep, terrible sleep, to the point where I wouldn't want to roll the dice on a third child because of it. I had to relearn how to sleep. And I use an Oura ring. You guys may have heard me mention this in some of the Instagram stuff, some of my previous lectures. I don't get paid to promote Oura rings at all. I think I've used a bunch of different measuring devices with sleep. I use the Oura ring only at night to measure my sleep. I really don't care about the activity part during the day. There are other devices, the Fitbit, the Whoop, and all these other different things that I've looked at and tried. And you know, there's low, and you got your Apple Watches now too. There's lower EMF, hardly any EMF that's thrown off with the Oura ring. And yeah, I think it's pretty accurate from what I've seen. So I've been super impressed with it as far as a measuring device. What you think you're getting with sleep, you're most likely not getting. And that's what I found when I first started incorporating this. You know, I go to bed, 9:30, 10 o'clock. I'm like, all right, count the hours. I'm like, all right, yeah, I'm getting about 7-8 hours. And I'm in bed that long, but I'm not getting that amount of sleep. It's very interesting to see what I thought I was getting and what I was really getting. Your sleep's made up of 4 different stages: awake, light sleep, deep sleep, and REM sleep. Awake time is natural break in sleep. Awake time, wake stage 0. Awake time is time spent in bed before and after falling asleep. It includes brief awakenings during sleep. Light sleep guides you into deeper stages. Light sleep and REM stage 1 and 2. Your muscles relax and may jerk, respiration slows, heart rate decreases, body temperature drops, sleep begins or transitions between cycles. Waking up is easier. Your body temperature drops and you go into deeper stages of sleep. That's why taking a bath or even a hot shower, going in a hot tub type of thing may help you sleep in the evening because your body temperature starts dropping a little bit more from when you come out of those things. Deep sleep focuses on restoring your body. Deep sleep and REM stages 3 and 4. Blood pressure drops. Body promotes muscle growth and repair. Blood flows increases to the muscles. Growth hormone is released. Tissue growth and cell repair occurs. Your brain flushes waste and shows long, slow brain waves. Waking up is more difficult, and when you are you're disoriented and groggy when you're woken up. And this is actually, when I was measuring my sleep, this is where I was lacking the most at, and very shocked that I could not get my deep sleep cycle situated. And initially, it was because when our kids were waking up, and I'd wake up and it'd interrupt my deep sleep cycle. But even after that, and I was getting situated and measuring my sleep, I still was not getting that deep sleep cycle, which is very key, obviously, from what we're going to talk about here. Deep sleep is the most restorative and rejuvenating sleep stage. Deep sleep includes all your sleep, including your naps. Deep sleep makes up anywhere to 0 to 35% of your total sleep. On average, adults spend about an hour, hour and a half. I was only getting 15, 20 minutes of deep sleep. You're supposed to get an hour to an hour and a half of their total sleep time in deep sleep. The percentage usually decreases with age. When you're in deep sleep, your body, your blood pressure drops, heart and breathing rates are steady, arm and leg muscles are relaxed, and it's harder for you to wake up. During that time, as we mentioned, the muscles grow and repair, immune system is refreshed, and brain flushes out toxins. So much key to immune system stuff, it's unreal. If you're not getting your sleep, you could be on the best supplements, and it doesn't matter what you're taking, you will frequently get sick. And this is what was happening to me. I was lacking of sleep. I was still trying to push through my workouts, push through the workday. I was getting these chronic little colds all the time. I'm like, what the heck? Something's up with my immune system. It was because of my sleep. Long naps and caffeine late in the afternoon obviously affects that deep sleep, so cutting those things out would help. I normally try not to take much caffeine in beyond, or recommend it for patients beyond anywhere past 3 p.m. typically. REM sleep re-energizes your mind. That's REM stage R sleep. Respiration increases, heart rate increases, temperature regulation is switched off. Vivid dreams may occur. Body becomes immobile to stop you from acting out in dreams. Benefits for memory, learning, and problem solving. My wife will wake up early in the morning. She'll be like, "Oh man, this is just right when I was getting my best sleep." A lot of people that wake up, they're like, "Man, it doesn't feel like I get my best sleep until I have to wake up and an alarm clock goes off." That's that REM cycle sleep. That's your sleep state. As far as dreams, you're getting the dreams and your brain is recharging. Absolutely key. Deep sleep, body recharges, the muscles, growth. REM is all with the brain. So if you're lacking certain things of these sleep cycles, it's absolutely key to kind of figure this out. REM is regulated by circadian rhythms, in other words, your body clock. Typically, you get more REM sleep later in the night. More of your deep sleep is earlier in the night. Getting a full night's sleep, sticking to a regular sleep schedule, and avoiding caffeine, alcohol, or other stimulants in the evening can increase your chances of getting more REM. It's awesome wearing this Oura ring, because you're going to see if you screw up, because a lot of people drink alcohol in the evening to kind of relax. They think, I could relax, I could fall asleep easier, and you might be able to fall asleep easier, but your metabolism's going, your blood sugar's thrown off, and it craps up your sleep, and you are not rested. Sugars, same thing. Eat junky in the evening and your metabolism's going like crazy, your heart rate's going to go like crazy. It's been fun playing around and dialing my sleep in with that Oura ring, because if I crap up and I cheat, I see exactly what it's doing. Associated with dreaming, memory, consolidation, and creativity, rapid eye movement sleep plays an important role in re-energizing your mind and your body. REM sleep includes all of your sleep, including your naps. Normally makes up anywhere between 50% of your total sleep. And we'll go through what a normal night actually looks like here. So on an average night, awake 2 to 5%, 45 to 55% with your light sleep. Deep sleep should be about 13 to 23%, REM about 20 to 25. A normal night, you should get about 4 to 5 90-minute cycles of wake, light, deep, REM, repeat. Wake, light, deep, REM, repeat. You'll typically get more of your deep sleep in the first half of the night and more of your REM cycle sleep later in the evening. Tips for improved sleep: increase in deep sleep after hard workouts. Your body will prioritize getting that deep sleep for that muscle regrowth. Higher REM rebounds after sleep deprivation. If you had a bad night, just deprived of sleep, up and down with certain things, your body will prioritize getting more REM the next night. Interrupted sleep cycles after caffeine. Any stimulant is going to affect, caffeine will definitely affect more of that deep sleep, and REM as well as what it mentions here, but a lot more of your deep, because it will kind of increase your adrenaline, increase the cortisol. You have a hard time falling asleep, and then it's going to cut right into that first part of that deep cycle sleep with most people. If you don't know where to start, this is a great starting point. I wish I would have recorded a little bit more of my aura measurements when I did this. This is the Core Restore of Orthomoleculars. That's a quick 7-day reset thing. 2 shakes, 2 detox packets, some snacks, and a normal dinner. This is very, very easy, tasty, and very doable for patients. If you just want to hit a quick little reset button, not do something crazy long, the 7-day Core Restore is the way to go. When I was doing this, I couldn't believe how great my sleep scores were, but I just didn't record them to have it for this lecture. Now, you guys see me throw this hair analysis up a lot. This actually is my hair test. You can see a little bit of my weaker digestion and why I'm always key about talking about hydrochloric acid to absorb your minerals. I'm low on lithium. I used to, would play some rounds of that Lyzyme Forte, and I never felt like it really did much for me. And I switched up a little bit, which I'm going to talk about in another few slides here. But so many people are deficient on lithium because it's not in the food, soil, and water. And you guys are so hyper adrenal, cortisol, stress that if you do have any, you're cooking this very quick on top of calcium, magnesium, and potassium. Benefits of nutritional lithium: slows dementia, improves cognition by optimizing levels of neurotransmitters, helps heal the brain from injury and stroke, reduces inflammation, supports methylation, helps healthy cells survive. It's a strong antioxidant, reduces irritability, reduces aggressive behavior of children. If they have got parasite issues, we treat a lot of that with the kids, but many people will benefit with this. It's the busy brain, not be able to slow down the busyness in your brain. The people that just got the eyes, just you could see them across the room. So Lyzyme Forte is great, and if you've been a patient who has used any nutritional lithium and you have not tried lithium orotate, this is the one that has been a huge game changer for me. I don't want to be slowed up during the day, but when I sleep, I want my brain to shut off. I normally wouldn't wake up in that too much and have a brain that's just going like crazy, but this shuts my brain off and I sleep great. I've used this combo with magnesium. MGzyme is a 3-form magnesium, 3 forms of magnesium. If you're more prone to constipation, you want to use MGzyme along with this lithium at night. This was the first time I was doing this. My sleep score was 88. You can see it 2 hours of REM, 2 hours of deep. Like I said, this is where I was lacking 15, 20 minutes at a time. I had concerns. I'm like, I'm snoring. Is it sleep apnea? And we're going to talk about that later in this lecture as well, too, to look at that. Heart rate drops down great. You can see where you get your deep sleep cycles awake, and then or your REM with the lighter blue and all that, the times where you wake up there. I'm a 9 to 5 person and wake up 5 in the morning, and I want to wake up. I want things to help me sleep and be rested, but I don't want to wake up groggy in the morning. And this has been phenomenal for me. Another sleep night, like I said, man, hit in the 80s, 90s. It's been great, and sleeping great is everything. Now, when I talk about mental health on my next lecture, sleep is absolutely key. It doesn't matter if you're taking nutraceuticals or pharmaceuticals. If you're not eating and you're not sleeping, you will go mentally nuts. So sleep is absolutely key. My heart rate variable, which I'll mention briefly here, in good range. What is heart rate variability? Heart rate variability is where the amount of time between your heartbeat fluctuates slightly. While heart rate variability may be present in healthy individuals, it can still indicate the presence of health problems, including heart conditions and mental health issues like anxiety and depression. A little bit better seeing in a diagram following this. Got high heart rate variability where things are spaced out, low where it's tighter in there between each beat. And this goes back to your fight or flight, rest and digest as far as sympathetic, parasympathetic, fight or flight, go mode. You got to know which way you go with this because there's specific nutrients you will cook quicker. And this is why, especially if you're more of the fight or flight and your low heart rate variability, things like calcium, magnesium, potassium puts the brake on your body, and those alkalizing minerals work better to be absorbed at night to help you sleep better. Kava is awesome. This is a special order with us now, but we still get that for patients. Kava is a great supplement, especially if you've been prone in the past to having used tranquilizers to help you sleep. Kava and that lithium combo is a great thing. There's ways we can muscle test you at the office. I'm going to talk about some functional medicine things and other measurements to look at some of the sleep stuff. But if you've got something, you have to measure your sleep to know what's working good for you and what's not working good for you. That's truly the bottom line. Now, if you want a magnesium, and this is the one I'm using now, that you absorb, this is one of the best absorbing magnesiums that we carry that will not have a bowel effect. If you do too much of the MG-zyme, you may have a loose bowel movement. If you're prone to constipation, you use the MG-zyme. If you're not prone to constipation but you want that magnesium source, you use the magnesium taurate. This has been the combo with me using the Zorix magnesium taurate as along with that lithium orotate that I sleep like a baby. And how I know that the magnesium's working better than the other ones is the lowest heart rate. My heart rate drops a lot sooner in the night than before. A lot of times your lowest area of your heart rate is going to drop around, say I'm waking up 5 a.m., you're going to drop somewhere between 3 and 5 a.m. with your lowest. If you're taking magnesium and you're absorbing it properly and you're getting a good dose, your heart rate is going to hit a lower point a lot sooner, and you're going to be a lot more recovered and rested. And that's absolutely key. Eat crap, have a Friday, Saturday night, piece of beer, drinks, whatever. Your heart rate is going to be through the roof, and you're not going to be rested. Talk a little bit more about magnesium real quickly. Magnesium and insomnia. Research shows that magnesium may help improve insomnia symptoms. In a study of elderly patients with insomnia taking 500 milligrams of magnesium daily for 8 weeks improved the many subjective and objective measures of insomnia. The patients fell asleep faster and slept longer, increased their sleep efficiency, meaning that they spent more time sleeping while they're in bed, woke up later, and reduced early morning awakenings. Experience increased concentrations of melatonin, which is a sleep hormone, and serum renin, which plays a role in regulating blood pressure. And that's key too, because if you're not sleeping, that renin will be off level, and this is where elevated blood pressure climbs up. These patients also experience decreased concentrations of cortisol, the stress hormone. Yes, and that's key. And one of the things that we use to measure that at the office is the adrenal stress profile test. This is something you could grab a kit at the office. I could ship it to you Skype patients. $65 with insurance. Cash price, I believe, is $120. This measures your cortisol, which is your fight or flight hormone. This is what I see a lot of in the office with patients who cannot sleep. They're stressed out to the max and their cortisol's high, high, high. If your cortisol's too high at night, you'll have a harder time falling asleep at night. If you have a hard time falling asleep at night because your brain's too busy and you can't shut off your brain, that may be a little bit more of the magnesium or the lithium thing. Your sources of stress, anxiety, fear, worry, anger, depression, guilt, overwork, physical, mental strain, excessive exercise, sleep deprivation, nutritional deficiencies, mold, noise pollution, late hour issues, surgery, trauma, inflammation, pain, all the things listed here. EMF, which we'll be talking about later in the lecture here. Learn to lower your cortisol. I play a lot of this stuff. I rotate between high stress adrenal and ADHS. I love, love, love rhodiola. I actually prefer the rhodiola ginseng. I took the rhodiola ginseng, my Cataplex G to get the choline, some ginkgo, and phosphorylserine to light up my brain for tonight's lecture. I love this stuff. You play the things properly, you feel good. It's awesome. Beetroot and heart rate variability. In short, beetroot improves your heart rate variability. I think this is also interesting too because we use a lot of beetroot that's an AF beta food or beta TCP, and the speeding up of your heart rate after meals is a very common symptom if you have a gallbladder issue. So if you have issues with your gallbladder, gas, bloating, indigestion, going in between loose and tight stools, burping, belching, gurgling the stomach, that's your gallbladder. And that speeding up the heart rate, we use a lot of beet products to help regulate and get that under control for you. In November through January, that gallbladder is pretty common, along with holidays like 4th of July, Labor Day weekend, and things like that when people go off and eat the junk food. And your college kids. That was all in, the symptoms are actually, that was putting it in my last lecture that's on YouTube, putting it all together. I did mention some of that as well, and part of that last lecture was addressing the symptom survey form, which what I'm going to talk about here, group 3 on that, was sugar handling, which is going to be for sleep issues here, as well as we're going to revisit this, come back with the mental health lecture too, because a lot of people have sugar handling issues. Eat when they're nervous, excessive appetite, hungry between meals, irritable before meals, get shaky if hungry, fatigue that eating relieves, lightheaded issues, heart palpitations if meals are missed. The afternoon headaches are very, very common, overeating the sweets, craving sweets and caffeine in the afternoon, moods of depression, blues, all that. So this is, if you've got sugar handling issues, a lot of these symptoms are key. Now, how does this relate to sleep? If you have some of these sugar handling issues, which a lot of it's hypoglycemia, low blood sugar issues, if your blood sugar dips at night, you will have a harder time staying asleep at night. So this is a starting point. This isn't everything. I'm not giving you guys the answer to everything, but this is a starting point. Bioglycozyme forte and Paraplex. If you have a hard time staying asleep, you need to learn to play products like this to help balance your blood sugar to help you stay asleep at night. If you follow me on Instagram lectures, you know that I absolutely love intermittent fasting. What is intermittent fasting? IF is currently one of the world's most popular health and fitness trends. People are using it to lose weight, improve their health, and simplify their lifestyles. Many studies show that it could have powerful effects on your body and brain and may even help you live longer. The 16-8 method mentioned down below is very common. People eat typically, say on average, say noon to 8 p.m., fast 16 hours to noon the next day. Do that once, maybe a few days a week. I love it a lot. I promote it heavily, but it's a little bit of a double-edged sword for patients because your moods and your energy will follow your blood sugar. And if you're having a harder time staying asleep at night and you're cutting out too early with not eating late enough in the evening, and your blood sugar plummets, you'll have a hard time staying asleep at night. So you got to be careful if you're prone to these blood sugar issues to pick quality windows to do intermittent fasting if you're going to follow that, because blood sugar and having a hard time staying asleep is going to be an issue. A lot of health benefits: weight loss, insulin resistance, inflammation, heart health, cancer, brain health, anti-aging. I love intermittent fasting. I'm very pro intermittent fasting for most patients. Daily fasting improves health and survival in male mice independent of diet composition. Eating patterns rather than diet composition influences longevity regulation. A prolonged daily fasting is associated with delayed onset of liver pathologies. Caloric restriction improves longevity of life. Life Extensions magazine pointed this thing out years ago. It has been known for quite a bit, and they've really talked heavily about it. In this study, a little bit of diagram, a little too condensed for a slide here, but if you're interested, you can see the link on the bottom and check out that study. Social media detox. Do you need a digital detox? What are some signs that you may be addicted? Spending a large amount of time on social media, thinking about social media often when you're not using it, spending less time doing other activities, hobbies, or spending time with others in order to use social media. Using social media to a point that it negatively affects different areas of your life, like work, school, relationships. Using social media to cope with negative emotions. I tell you, it is so evident among the teenage patients I treat at this office with anxiety and depression. But key thing, lack of motivation. Lack of motivation. Being overstimulated with all the social media has cooked the dopamine in the brains of individuals. And I get so many people in here on a regular basis now. I've got no motivation. My motivation is completely shot. It's unbelievable. Research shows digital devices are destroying our eyes. Absolutely. According to a new study, the light from our digital devices is not only harmful, prolonged exposure can spur macular degeneration, a condition that can lead to blindness, which is more common with diabetic type patients. What makes the finding deeply troubling for eye health is that once dead, these cells do not regenerate. Adults over the age of 50 and those with compromised immune systems are most at risk for significant loss of vision due to death of these non-regenerating cells. So, yes, how much screen time are you doing? You know, I recommend, and I still will recommend, blue light glasses for people that are doing a lot of screen time with in general, and work stuff, computers, and that. Unfortunately, the literature doesn't support much of it helping people, and I thought that, you know, maybe I could find some literature with blue light glasses helping people with sleep, because a lot of that blue light will interfere with secretion of melatonin, which could affect your sleep cycles. But there's not much research supporting how effective blue light glasses are for people. But I do have patients that say, especially if they, you know, are from the computer with work a lot and get dry eye symptoms, that the blue light glasses are beneficial for them. So regardless of what the literature supports or doesn't support, try it for yourself. Effects of frequency, power frequency electromagnetic fields on melatonin in sleep in rats. The pineal gland is likely to sense EMFs as light, but as a consequence may decrease the melatonin production. In most other studies, melatonin is decreased with individuals under electromagnetic fields. In this study, melatonin production was mildly increased in exposed animals, although there were no statistical significant changes in sleep structure. Exposed animals showed a slight decrease in REM cycle sleep. So this affected more of the REM cycle sleep in these rats. Power frequency magnetic fields induce a marginal statistically significant increase in melatonin levels in exposed rats compared to control. But like I said, other studies show that yes, that EMF factor will decrease melatonin. This is a good case study. Texas Skype patient, female, low energy, fatigue, trouble staying asleep. Mother is type 2 diabetic, not rested in the morning, having some night sweats. So, we ran a hormonal panel on her, a saliva kit test, runs about $150 through Genova Labs. Her estrogen levels bottom out, progesterone is higher there, but testosterone and estrogen is low. I think she was having hot flashes, premenopause type stuff? Not necessarily. I have had patients that they can't sleep at night because of the hot flashes, and it's correlated with this, and we've done great bioidentical treatment with them to help them balance their hormones and sleep better. We've had other hormonal issues, even something more surprising, a thyroid being out of range and not sleeping because of that, and that's a little bit more of an odd one because it typically tends to be more adrenals from what I see. Her adrenal, most people, they're not sleeping, their cortisol's too high. She was bottom out. She was hypoadrenal. She's not up with a lot of her cortisol, and her DHEA is very low too, so she's a bit in adrenal fatigue. Now, this one-day hormone test actually checks your saliva. So I got a way of measuring your melatonin, I have a way of checking your melatonin levels via saliva through this one-day hormone test. And she's bottom out all across. And this is the more important area where we want, later in the evening, we want this melatonin level up. Patients that have melatonin too high in the morning, these are people not getting enough light and wearing sunglasses, and their melatonin is too high. You need light to help suppress that. You feel groggy just because of not getting enough light in the morning. In the evening, you're not getting it high enough, you're going to have some sleep issues, and this is something that we had to fix on her. So we got cool ways of measuring the melatonin levels that a lot of people didn't know. Follow up, things are better than they were before. Complaints, sleep is improving, energy is okay. So having kids 5 and 2, I could correlate that it was a little bit of her sleep issues as well. Melatonin. So when we were down in at the functional medicine, I think in North Carolina, they had so much literature and so much talk about melatonin. I was just jaw dropped that I just didn't realize how much there was. You go on PubMed and look up melatonin. I try to summarize it the best I could in one slide. Melatonin has anti-inflammatory properties, antidepressant properties, it's an antioxidant, and it has anti-tumor activities. There's more breast cancer in the night shift workers because of suppressed levels of melatonin. It is in the literature. This is our melatonin supplement at the office. Symptoms of EMF toxicity with sleep. Sleep problems and difficulties, suppressed melatonin. Day-night biorhythms, off schedule, fatigue, and general lack of wellness. More fluoride exposure leads to less sleep. Exposure to higher levels of fluoride in drinking water has been linked to less sleep, likely due to its adverse effects on the pineal gland, raising questions that it could also interfere with the gland's role of seal of the soul. As we age, that pineal gland can get calcified and also create some sleep issues with patients as well. And I mentioned the EMF stuff. I had a lecture on this that's on YouTube back in 2020, Dangers of EMF in Your Health. It is very much worth reiterating some of these slides. What are EMFs? Electric and magnetic fields are invisible areas of energy, often referred to as radiation. that are associated with the use of electrical power in various forms of natural and man-made lighting. As the name implies, EMFs are created when you combine electric and magnetic fields. Electric fields are produced by voltage, and magnetic fields are created by the current of energy flow in a given direction. How do they cause damage? They increase in harmful free radicals, oxidative stress, and genetic damage. Here's the EMF spectrum. You've got ionizing radiation, non-ionizing radiation, visible light that you could see, different examples of things of where they fall in here. There's three kinds of EMF, electric or magnetic fields, electric fields, and radioactive frequency fields. What EMF level is safe? That is a very, very good question. If you're a technical person, I want to break down charts and numbers, go to this website, emfcenter.com. It is a great, great website if you want some resources. I have to emphasize this, with these new cell phone towers, you got 4G and 5G. 5G is a lot stronger than 4G, and it's a lot more penetrating. And I really feel that this is starting to affect people's sleep slowly by slowly, and other health issues. Now, here's your regular cell phone. 5G is about 90 gigahertz here, microwave spectrum. We are getting cooked with new technology, unfortunately. Now, I had this tri-field measuring device I lent out to a patient and never got back. This is me measuring my smart meter at the house. Outside of it and the other side of the couch, and you could switch the settings all around. I've got to emphasize and make a very, very strong point to you guys who are trying to measure this. This does not pick, a lot of your regular EMF measuring devices does not pick up the frequency of 5G, so you don't know what you're getting with 5G, and they threw up these towers the last 2 years like crazy everywhere, so you cannot measure what you're being affected with, unfortunately. The devices that measure specific 5G frequency are like 20 grand devices. It's crazy. So, adverse health effects of 5G mobile networking technology under real life conditions. You're seeing things that are going to lead to cancer, neurodegeneration, infertility, neurobehavioral issues, cardiovascular, right in the center, sleep disorders. Sleep disorders. I swear more and more people are going to be affected with this sleep issue. How do you combat 5G when we're swimming in this stuff? You want to be high in your antioxidants and you want to be high on your glutathione levels. High spectrum range of 5G leads to mutation of cells, which creates tumors and results in cancer. You can see radiation source, DNA damage, cancer, tumor. If you're soaked with heavy metals, you are going to be a magnet for an antenna for more of this EMF stuff. Harmful effects of 5G. 5G spectrums also induce electromagnetic sensitivity, which has characteristics such as lack of concentration, headaches, depression, dizziness, insomnia, nausea, and heart palpitations. Your heart is a very electrical organ. Too much EMF issues. I got patients with heart palpitations that I simply have them ground, get rid of the EMF stuff, devices that they're using, and regulate the heart just from playing this whole EMF factor with them. Learn to ground. It's the summertime. Go outside barefoot in the backyard. I play with my kids on a trampoline out in the backyard all the time, barefoot. Discharge this electricity out of your body. It improves your quality of sleep and feeling restful upon awakening, reduces muscle stiffness and soreness, reduce chronic pain, cortisol management, decreases inflammation, raises your heart rate variability, speeds up wound healing, improves mood, reduces inflammation. I have an earthing pad. This is one thing I have not done yet that I think I'm going to do is use my Aura Ring, measure my sleep with a earthing pad and see how much of a difference that I'm getting with that. Putting this lecture together, and I was just thinking, like, man, that thing's been packed up. I changed sheets on the bed. I forgot to put it back on, and I'm like, that'd be great to measure that and kind of see what I'm getting. Like I said, you're going to know what you're getting and what you're not getting if you measure your sleep. Got to measure your sleep with something. This is one of our patients. If you want someone to come to your house and check EMF levels and geographic lines and that kind of thing, Henrik could do some cool stuff. He's local in Michigan. Give him a call. I used to work at the hospital. I used to work afternoons and midnights when I used to, come off my afternoon shift and drive home. I want my brain to mellow out. You got all these brain waves. I used to listen to specific classical music that had brainwave music patterns in there to help my brain relax. I thought that was kind of cool. The Chinese biomeridian clock. Are you waking up somewhere in the middle of the night at the same exact time? Maybe you're waking up 2 in the morning every night. Maybe your liver's trying to tell you something. Maybe you can't make it past 1 a.m. Maybe you got a gallbladder acting up that's trying to tell you something. This is very cool. Chinese biomeridian clock. If you're waking up at that same exact time, some organ may be trying to tell you something. Now, if you are not sleeping at night, this is my lecture you also find on YouTube, Preventing Dementia. If you're not sleeping at night, a lot of individuals will use sleep medications and tranquilizers, benzos, and things of that nature. A lot of those medications are linked to dementia. If you don't have to use them, I would not use them long term. Dr. Tent and Gil and I do not recommend these types of medications for a short-term solution. Okay, long-term answer, no. We want you to address why you are not sleeping. But if you're not sleeping and you've exhausted all your conservative approaches, mental health-wise, you need to sleep. Your brain needs to recharge. You need that REM cycle sleep. I've been super impressed with the CBD products that we're carrying at the office. I've done a handful of these and measured it with my sleep. I've got the opposite effect. CBD has a more of a stimulant effect on me. And when I try to use this for sleep, it kills and dives into my deep sleep cycle and shortens my my deep sleep cycle. So other patients, it works great. And if you got chronic pain and this doesn't work, medicinal marijuana may be more beneficial for you. We got patients that use edibles and it helps with their pain. They could sleep better because less pain, and also sleep better because of the medicinal component with it. So, I'm for that as well. If you have pain, neck, back wise, and that's prohibiting you from getting sleep, get adjusted. Chiropractic care. We are chiropractors at the office here. Get adjusted. Get out of pain. Sleep loss and inflammation. Lack of sleep increases inflammatory cytokines, compromises the immune system, and contributes to insulin resistance. My lack of sleep and lack of that deep sleep cycle killed my immune system. I was chronically getting stupid little colds all the time. And I tell you what, I'm down to a routine. If I get the slightest little tickle in my throat, I'm forcing myself to sleep extra hours for a few nights in a row, and I'm doing hourly doses of vitamin C, and I will sleep it off and hit it with the supplements before anything ever really comes on. My immune system has been absolutely dialed in now ever since I focused on this sleep factor. What is sleep apnea? Potentially serious sleep disorder in which breathing repeatedly stops and starts. Risk factors include age and obesity. It's more common in men. Symptoms include snoring loudly and feeling tired even after a full night's sleep. Treatment includes lifestyle change, weight loss, CPAP machine with a lot of people. I was trying to get something geared for this lecture. If you are an out-of-state patient, you could do an at-home sleep study. This Watch Pat 1, we got some of them at the office. We had one of our Instagram guy, our social media guy, I should say, do a study. We were wanting to carry this in office. We had disposable ones where you purchase it, you use it, you throw it away, you get your study read, and you go from there. If you're an out-of-state patient and you want to do an at-home sleep study, this is the one that you'd want to try to go directly through them and get it. Unfortunately, we weren't happy with the company and just going back and forth. We were like, enough, you know what, we're gonna go a different direction. But the study that we did with one of our workers at the office was very intriguing because he snores at night, he's not rested, he's using Adderall to get by day. It will give you a sleep score with this as far as sleep apnea goes, to if it's mild to moderate to severe. If it's severe, most of these patients need a CPAP machine. If it's mild to moderate, some things could kind of be fixed. One of the things that you could kind of do is a specific dental mouthpiece, which I'll get into in another slide. But on his case here, it's interesting. Every time it tells you your body position, and every time he was on his back, he was snoring more. So every time he's on his back, he's snoring more. On his back, snoring more. So when you're on your back, your tongue goes back to your throat, you snore more, and it's cutting off his breathing. His sleep apnea is very much positional with him. So a mouthpiece would help, but also trying to have something where he's forced not to sleep on his back and on his side would help him out tremendously. This is a dental piece that I was telling you about, bigsmiles.net. If you're in Michigan, this is our dentist slash patient, Dr. Bologna. You could check her out if you have had a sleep study and you don't want to do the CPAP thing. This is an option for you guys. And she may have referrals as well if you're not in that area, or even possibly even out of state as well, as far as the group that she uses. Got another patient that, well, actually, I'll jump here. So if you are in Michigan and you want an at-home sleep study, this is the direction that we're actually going to go. Sleep at home diagnostic testing. This is the same thing, very similar to that last device I was showing you, where that other one, you put it on your finger, it goes to the watch, and then it goes to your phone and it records everything. They have a similar setup with theirs. This is a Michigan-based. If you're a Michigan patient and want to do an at-home sleep test, that your study is directly read by a sleep doctor and then your score is given to you, this is who you want to use. And we should be having kits at the office here, I believe. It's kind of brand new. If you're interested in this, ask one of the back girls, email us, we'll let you know about it. If you have PTSD, other traumas, anxiety, depression, addictions, things that are really tying up your brain from sleeping good at night, EMDR is what I would recommend for you to look into. I got one of my patients who's out in Clarkston that does this type of treatment. It's a rapid eye movement treatment versus going to a psychiatrist and being coached into having a chemical deficiency in your brain and you need to be on this medication for the rest of your life. If you could address it from a different angle, I've been pretty impressed with what I've seen with some EMDR treatment with patients. Come to me, all you who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. Give it all to God. When I was measuring my sleep, my worst night of sleep used to be Sundays and the Mondays. I always thought it was crappy food, getting into too many sugary foods on the weekends. And then my brain just rolling around on Sundays, just think about everything in the week that's got to go on and whatnot. Change some things around in life. Gave it all to God. Some of my best nights of sleep are Sunday and Monday now. So, where do you start? Measure your sleep. If it's not an Oura ring, you want to measure your sleep because you gotta know what's working, what's not working, where you're lacking, what are you getting, what did you think you're getting that you're not getting, like I was. If you're in pain, chiropractic care, get some chiropractic care. Come in the office, I'm going to muscle test you. I'm going to muscle test you to see what supplements work good for you. I'm going to see if your brain's on fire. I'm going to see if it's a blood sugar issue. We're going to see if your adrenals are out of whack. We'll muscle test you and see what pops up initially. Rule out the sleep apnea thing. Customize a sleep supplement protocol for you and measure it. And then beyond that, we got some advanced functional testing that we could do, whether it's hormonal testing, blood testing, you name it. Sleep hygiene checklist. Limit your caffeine usage. Get sunlight. Sleep in a dark room. Turn the lights down. Temperature. Drop the temperature down. Sauna. Sound machine works great. It's amazing. I'll even use a little light fan to drown out noises. And I've gotten so used to that now I can't sleep without it. Journaling, essential oils like lavender, valerian, things of that nature. Track your sleep. Track your sleep with something. Exercise earlier versus later. Reduce your stress. A weighted blanket. I actually use a weighted blanket. I've been surprised at how well that works as well. How is it going to work for you? Measure your sleep. Notable mentions of supplements I didn't talk about: insomnia relief formula, valerian complex, de-stress, GABAval. Valerian is herbal Valium. This stuff works great. Dr. Jeff, what kind of bed do you sleep on? I use an IntelliBed. It's a chemical-free, chiropractic recommended bed. If I had one beef about it, with it being a little bit of a gel top, if your spouse moves a little bit, the bed, the one I've got kind of jiggles a little bit. So that's a little bit annoying, but for the most part, this has been a phenomenal bed. Chiropractic wise, sleeping on your back and your sides, recommend it. Unfortunately, a lot of back sleepers tend to snore more, so ideally I'd even say your side sleeping is going to be a little bit better. This is a little bit more of a breakdown in that bed if you're interested in looking into one. An Oura ring. Like I said, I'm promoting them because I like them. I don't get paid and any kickbacks from them. I found this is very beneficial when I was measuring EMF off of your Apple Watches and other devices. That one isn't really spewing out anything, and I was very impressed with how well it measured the sleep and when I was comparing them all back and forth. Where do you want to start possibly? Hey, like I said, I mentioned that Core Restore Orthomolecular is a great supplement. 2 supplement shakes, 2 detox packs. You could throw some snacks and a good dinner in there. You'll lose some weight. You'll sleep better. I was very, very impressed with how well I was sleeping while I was doing that. The functional medicine testing, I do a lot of Genova-based things. We do hair testing. We do so many different things at the office. And it's only going to get better because now since we're working with Quest Lab, we're going to really utilize that lab and have better panels that we can use with patients, run it through their insurance, specific supplement protocols. We're going to beef up our website to kind of have this all on there, promote it on Instagram. There's a lot more to come from us in our office. Supplement companies that we use. Check out our website. The list of my lectures are growing. If you guys have any interest of topics, shoot me an email, contact me, let me know. I'm always open to doing some things, but the mental health thing really, really needs to be addressed next. And I've got to work all summer, and maybe even more, putting this next lecture together, because it's absolutely key. And I even said back in 2021 that mental health is going to be a big issue going forward, and people are stressed and pushed and maxed to the limit. So, take care of your body, and your body will take care of you. That's it. The end.